Are your wisdom teeth wonky? Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesdays. Every week we love to cover different topics or products that we use here in our office or think are important for our patients and viewers to know about. That way we can keep you guys educated and make sure that you have all the tools you need to keep your mouths nice and healthy. Last week was actually Thanksgiving week. I hope everybody had a great Thanksgiving. You guys got a glimpse into the staff here at Dublin Dental Care and heard what we were thankful for our Thanksgiving this year. But we're turning it back to dental topics this week, and this week we are talking about wisdom teeth and why we may refer you to have them taken out, and why it's important that you follow through with it if you have gotten a referral to do so. Not very many people are lucky enough to have all 4 of their wisdom teeth come in perfectly straight and be functional in their mouth. Wisdom teeth can help in chewing, but that's if all of your wisdom teeth come through the gums properly. Most of us have them either impacted or not coming through the gums the way that they're supposed to, so we end up having to have them taken out. There are a couple that may not ever develop, and that's awesome if that happens to you, but we're going to talk about what happens if they're not coming in properly. So I'm just going to go through and show you different ways that they may be erupting in your mouth and why we recommend having them taken out if that's happening. So this first tooth that I'm going to talk about is actually just not erupting all the way. It looks like it could possibly erupt properly, but it's just not pushing through the gums. So we would recommend having that extracted. If you have all 4 of them in your mouth and the other ones are causing issues, we'd have you have that one taken out also, just because if it's not coming through now, it's not going to come through, and we would hate for an infection to start occurring around the crown of the tooth, which could affect the tooth in front of it. So that's important to get that taken out if we tell you to. This tooth right here is coming through the gums partially. Part of the top of the tooth or the crown is through the gums, but the tooth is leaning towards the front of the mouth, and so it's hitting this molar in front of it. So because it's running into that tooth, it's never going to erupt properly. And this can cause issues because part of it's erupted, so you do have the tooth structure hitting the tooth in front of it, which can cause bacteria to get down in between the 2 crowns of the teeth. And that can start causing decay to occur on the molar in front of it, which we don't want because that's a nice healthy tooth that's through all the way. You also have a little bit of the gums that are still over top of the crown of the tooth, and that can cause issues because it causes a little flap over the tooth structure, and bacteria can get up underneath that and cause cavities to form underneath the gums. It's hard for you to keep clean. Food can get impacted in there, so we would recommend having this tooth extracted for all those reasons, just to make sure that your gums stay healthy and the tooth in front of it stays healthy. This tooth right here is actually not ever going to come through the gums at all because it's impacted towards the front of the mouth into the sides or the roots of the teeth in front of the tooth in front of it, which can, like I said before, cause damage to the tooth in front of it. This can also cause these perfectly straight teeth to start shifting because of the pressure that it's putting on that tooth. And if you had braces, we know we want to keep your smile nice and straight, and so that would be important to get taken out so that your teeth don't start shifting and overlapping and causing you to not have that nice straight smile anymore. And then finally, we have this tooth right here, which is coming through the gums partially, but it's pointed towards the back of the mouth. And we have that bone that's back towards the back of the mouth, so it's causing this to not erupt fully. It can cause damage to the bone back there or jaw pain. You again have part of the gums that are erupted over the crown, but it's not fully erupted, so you can get impacted food underneath there. Bacteria can sit in there, cause cavities to form on that tooth, or cause your gums to get really infected and sore. So it's important to make sure that you get this taken out so we're not having those issues in your mouth. So if your dentist has recommended you get your wisdom teeth taken out, it's not just for you to have to do another dental procedure. It is so that the rest of your mouth stays nice and healthy and you don't have any other damage occurring to the teeth around it. So make sure that you do follow what your dentist says and get those teeth taken out sooner rather than later, just so that you don't have any other issues occurring. I want to thank you for joining us this week. Hopefully you got some good information, and if you have a referral sitting at home that you just haven't done, hopefully this gives you a little push to get those teeth taken out so that your mouth stays nice and healthy. If you have any questions or comments for me, feel free to email me. My email is christina@dublindentalcareohio.com. Check out our website at dublindentalcareohio.com. You can actually set up appointments through that website to come in and visit us. And then we love hearing your comments or even seeing your likes on our videos. So feel free to check out all of our videos that we've done in the past. They're on both our website or our Facebook page and our YouTube channel. So check those out, and I hope you have a great rest of your week, and we'll see you next week.